treatment progress, and assess organ function. This knowledge is essential for anyone studying psychology, medicine, or preparing for exams like the CPC, as it highlights the role of advanced imaging techniques in modern healthcare. Let's explore the interaction between the amygdala and the frontal cortex in a clear and simple way. What is the amygdala? The amygdala is a small, almond-shaped structure located deep within the brain. It plays a key role in processing emotions, particularly fear and pleasure. The amygdala helps us recognize emotional stimuli and react to them, which is crucial for survival. For example, if you see a snake, your amygdala triggers a fear response, helping you react quickly to avoid danger. What is the frontal cortex? The frontal cortex is the front part of the brain, located behind the forehead. It is involved in higher-level functions such as decision-making, planning, reasoning, and regulating emotions. The frontal cortex helps us think through situations, control our impulses, and make thoughtful choices. For example, if you feel angry, the frontal cortex helps you decide not to lash out and instead respond calmly. Interaction between the amygdala and frontal cortex. The amygdala and frontal cortex work together to help us manage our emotions and responses. Here's how they interact. 1. Emotional processing. When you encounter an emotional situation, the amygdala quickly processes that emotional information. It acts almost like an alarm system, rapidly assessing whether the situation is safe or dangerous. For instance, if you see someone approaching you quickly, your amygdala may trigger a fear response, prompting you to react quickly. 2. Regulation of responses. Once the amygdala has processed the emotional response, the frontal cortex comes into play. It evaluates the situation more rationally and helps regulate the response initiated by the amygdala. For example, if you feel scared because someone is running towards you, your amygdala may trigger a fight or flight response. However, your frontal cortex helps you assess whether the person is actually a threat or just running for exercise. This allows you to decide how to react appropriately. 3. Decision-making. The interaction between these two brain areas is crucial for making decisions based on emotions. The amygdala provides the emotional context, while the frontal cortex analyzes that context to help you make a more reasoned choice. For example, if you're about to give a speech and feel anxious, your frontal cortex can help you remember that you have prepared well, allowing you to calm your nerves and perform effectively. 4. Learning from experience. The amygdala is also involved in forming emotional memories, while the frontal cortex helps us learn from those experiences. For instance, if you had a negative experience with a dog, your amygdala may remember the fear associated with that event. Later, the frontal cortex can help you analyze the situation and understand that not all dogs are dangerous, allowing you to adjust your response in the future. Examples of amygdala and frontal cortex interaction. 1. Fear response. Imagine you're watching a horror movie. The scary scenes activate your amygdala, making you feel frightened. However, your frontal cortex reminds you that it's just a movie and not real, helping you manage your fear and enjoy the film. 2. Social situations. In a social setting, if someone makes a rude comment, your amygdala might trigger an immediate emotional reaction, such as anger. Your frontal cortex then evaluates the situation, allowing you to decide whether to confront the person, walk away, or respond in a calm manner. 3. Stress management. If you're stressed about an upcoming exam, your amygdala may heighten your anxiety. However, your frontal cortex can help you develop a study plan and remind you of past successes, helping to reduce your stress and improve your focus. Importance of amygdala and frontal cortex interaction. Emotional regulation. The interaction between the amygdala and frontal cortex is crucial for regulating emotions. It helps us respond appropriately to different situations and manage our feelings. Decision-making. This interaction is vital for making informed decisions. While emotions provide important information, the frontal cortex helps ensure that our choices are logical and well-considered. Mental health. Understanding how these brain areas interact can help in addressing mental health issues. For example, conditions like anxiety and depression may involve dysregulation between the amygdala and frontal cortex, leading to heightened emotional responses and impaired decision-making. Conclusion. In summary, the amygdala and frontal cortex interact closely to manage our emotions and responses. The amygdala processes emotional information quickly, while the frontal cortex helps regulate those emotions and guide our decision-making. This interaction is essential for emotional regulation, thoughtful choices, and overall mental health. Understanding this dynamic is particularly relevant for anyone studying psychology or preparing for exams like the CPC, as it highlights the complex relationships within the brain that influence behavior and emotions. Let's explore the mirror neuron concept in a clear and straightforward way. What are mirror neurons? Mirror neurons are a special type of brain cell that respond both when we perform an action and when we see someone else perform that same action. They were first discovered in the early 1990s in the brains of monkeys, and later research found similar neurons in humans. These neurons mirror the activity of others, hence the name mirror neurons. Key concepts of mirror neurons. 1. Action understanding. Mirror neurons help us understand the actions and intentions of others. When we see someone doing something, our mirror neurons activate as if we were performing the action ourselves. This allows us to understand what the other person is doing and why. 2. Empathy. Mirror neurons are believed to play a role in empathy, the ability to understand and share the feelings of others. When we see someone in pain or experiencing joy, our mirror neurons can activate, making us feel a similar emotion. This connection can help us relate to others and respond appropriately to their feelings. 3. Learning through imitation. Mirror neurons also contribute to learning by imitation. Children often learn new skills by watching others, like tying shoes or playing a sport. Mirror neurons facilitate this process by helping the brain simulate the observed actions, making it easier to replicate them later. 4. Social interactions. These neurons are thought to be important for social interactions. They help us interpret social cues, such as facial expressions and body language, which are crucial for effective communication and building relationships. How mirror neurons work. 1. Observation. When you watch someone perform an action, such as throwing a ball, mirror neurons in your brain become active. This activation occurs in areas of the brain that are also involved in planning and executing the same action. 2. Internal simulation. Your brain simulates the action you are observing. So, even though you're not physically throwing the ball, your brain processes the action as if you were. This helps you understand the mechanics of a throw and the intention behind it. 3. Response. When your mirror neurons activate, they can influence your own actions and reactions. For example, if you see someone smile, your mirror neurons might prompt you to smile back, even if you weren't consciously thinking about it. Examples of mirror neuron function. 1. Watching sports. When you watch a soccer game, your mirror neurons may activate as you see players dribble the ball or score a goal. This activation can make you feel excited or even inspire you to play soccer yourself. 2. Learning to dance. If you watch a dance tutorial, your mirror neurons help you understand the movements being demonstrated. This internal simulation makes it easier for you to mimic the dance steps when you try them out. 3. Feeling empathy. If you see someone trip and fall, your mirror neurons may activate, making you feel a sense of discomfort or pain. This reaction can lead you to help the person or feel compassion for their situation. Importance of mirror neurons. Understanding behavior. Mirror neurons help researchers understand how humans learn and interact socially. They provide insights into how we develop skills and understand others' actions and emotions. Social bonding. The role of mirror neurons in empathy and emotional responses can help explain how social connections are formed. By mirroring each other's emotions, people can build stronger relationships. Therapeutic applications. Understanding mirror neurons has implications for therapy, especially in treating social disorders like autism. Therapists may use techniques that leverage mirror neuron activity to enhance social understanding and interaction skills. Conclusion. In summary, the mirror neuron concept refers to a type of brain cell that activates both when we perform an action and when we observe someone else performing that same action. These neurons play a crucial role in understanding others, fostering empathy, and learning through imitation. Understanding mirror neurons is important for grasping how we interact socially and emotionally, making this concept relevant for anyone studying psychology or preparing for exams like the CPC. Let's explore interpersonal neurobiology in a simple and clear way. What is interpersonal neurobiology? Interpersonal neurobiology is a field of study that looks at how our brains are influenced by our relationships with others. It combines insights from neuroscience, psychology, and human relationships to understand how social interactions affect brain development and functioning. The term was popularized by Dr. Dan Siegel, who emphasizes the importance of connections between people and how these connections shape our mental health. Key concepts of IPNB. 1. Neuroscience of relationships. IPNB emphasizes that our brains are not isolated. They're shaped by our interactions with other people. The way we connect with others, through communication, emotions, and experiences, affects how our brains develop and function. 2. The role of connection. Human beings are social creatures. Our relationships can influence our emotional well-being, mental health, and even physical health. Positive relationships can enhance brain function and promote resilience, while negative or toxic relationships can lead to stress and mental health issues. 3. Integration. A key idea in IPNB is integration, which refers to the way different parts of the brain and different aspects of our experiences work together. Integration is important for healthy functioning, as it allows us to balance emotions, thoughts, and behaviors. For example, integrating emotional experiences with rational thinking leads to better decision-making. 4. Developmental impact. IPNB looks at how early relationships, especially with caregivers, shape brain development. Positive early interactions can lead to a well-regulated emotional system, while negative experiences can lead to difficulties in emotional regulation and social interactions later in life. 5. Mindfulness and awareness. IPNB also emphasizes the importance of being aware of our thoughts and feelings, as well as those of others. Mindfulness practices can help enhance our ability to connect with others and improve our emotional regulation. How IPNB works. 1. Brain development. Our brains develop based on the experiences we have with other people. For example, a child who receives consistent love and support from parents is likely to develop a strong sense of security, which positively influences their brain development. 2. Emotional connections. When we interact with others, our brains release chemicals like oxytocin that promote feelings of bonding and trust. These emotional connections can enhance brain function and overall well-being. 3. Stress and relationships. Negative relationships can cause stress, which affects brain functioning. For example, chronic stress from a toxic relationship can lead to changes in the brain that make it harder to regulate emotions and cope with challenges. Examples of IPNB in action. 1. Therapeutic relationships. In therapy, the relationship between a therapist and a client can significantly impact the client's healing process. A strong, trusting relationship can help the client feel safe and supported, facilitating emotional growth and brain integration. 2. Parenting. A parent's ability to connect emotionally with their child affects the child's brain development. For instance, when parents respond sensitively to their child's needs, it promotes secure attachment, which supports healthy emotional regulation and social skills. 3. Team dynamics. In a work or sports environment, positive interpersonal relationships can lead to better teamwork and collaboration. When team members communicate effectively and support each other, it enhances group cohesion and performance. Importance of interpersonal neurobiology. Mental health. Understanding IPNB can help improve mental health interventions by highlighting the importance of relational dynamics in therapy and support systems. It encourages a holistic approach that considers relationships as a crucial aspect of mental health. Education. In educational settings, recognizing the role of relationships in learning can help educators create supportive environments that enhance student engagement and achievement. Personal development. IPNB encourages individuals to reflect on their relationships and how these connections impact their emotional well-being. By fostering positive connections, people can enhance their mental health and resilience. Conclusion. In summary, interpersonal neurobiology is the study of how our relationships with others influence our brain development and functioning. It highlights the importance of connection integration, and mindfulness in shaping emotional well-being and mental health. Understanding IPNB is valuable for anyone studying psychology, mental health, or interpersonal relationships, as it underscores the significant role that social interactions play in our lives. Let's explore stress hormones, particularly cortisol, in a clear and straightforward way. What are stress hormones? Stress hormones are chemicals that your body releases in response to stress. They prepare your body to handle challenges, whether they are physical threats or psychological stressors. The most well-known stress hormone is cortisol. What is cortisol? Cortisol is a steroid hormone produced by the adrenal glands, which are located on top of your kidneys. It plays a critical role in how your body responds to stress and helps regulate various functions, including 1. Metabolism. Cortisol helps control how your body uses carbohydrates, fats, and proteins for energy. It ensures that you have enough fuel to respond to stress. 2. Blood sugar levels. Cortisol increases blood sugar levels by promoting gluconeogenesis and ensuring that your body has enough energy during stressful situations. 3. Immune response. Cortisol has anti-inflammatory effects, helping to regulate the immune system. While this can be beneficial in reducing inflammation during stress, prolonged high levels of cortisol can weaken the immune response. 4. Blood pressure regulation. Cortisol helps maintain blood pressure, ensuring that your body can efficiently transport oxygen and nutrients to tissues during stressful events. How cortisol works. 1. Stress response activation. When you encounter a stressful situation, your brain sends a signal to the hypothalamus, which releases a hormone called corticotropin-releasing hormone. This hormone stimulates the pituitary gland to release another hormone called adrenocorticotropic hormone. 2. Cortisol release. ACTH travels to the adrenal glands, prompting them to release cortisol into the bloodstream. This process is part of the hypothalamic pituitary adrenal axis, which is the body's central stress response system. 3. Effects of cortisol. Once released, cortisol prepares the body for a fight or flight response. It increases energy availability, sharpens focus, and temporarily suppresses non-essential functions to prioritize immediate survival. Effects of cortisol on the body. 1. Short-term effects. In the short term, cortisol can be beneficial. It helps you think clearly, respond quickly, and manage pain. For example, during a stressful event like a sports competition, cortisol can boost your performance by increasing alertness and energy. 2. Long-term effects. However, if stress is constant, leading to prolonged high levels of cortisol, it can have negative effects on the body, including weight gain. High cortisol levels can lead to increased appetite and cravings for unhealthy foods, contributing to weight gain. Sleep problems. Elevated cortisol can disrupt sleep patterns, making it difficult to fall asleep or stay asleep. Weakened immune system. Chronic high levels of cortisol can suppress the immune system, making you more susceptible to infections and illnesses. Mental health issues. Prolonged stress and high cortisol levels are linked to anxiety, depression, and cognitive difficulties. Examples of cortisol in action. 1. Exam stress. If you're preparing for an important exam, your cortisol levels may rise as you feel anxious about your performance. This increase in cortisol can help you focus and stay alert while studying. However, if the stress continues for a long time without breaks, it may lead to burnout or anxiety. 2. Public speaking. Before giving a speech, you might feel your heart rate increase and your palms sweat. These physical reactions are partly due to cortisol release, preparing your body to handle the perceived threat of public speaking. 3. Chronic stress. If someone experiences ongoing stress from work, relationships, or financial issues, their cortisol levels may remain high over time. This chronic stress can lead to health problems like hypertension, digestive issues, and mental health disorders. Managing cortisol levels. 1. Stress management. Engaging in stress-reducing activities such as exercise, meditation, or deep breathing exercises can help lower cortisol levels and improve overall well-being. 2. Healthy lifestyle. Eating a balanced diet, getting enough sleep, and maintaining social connections can also help regulate cortisol levels and support your body's stress response. 3. Mindfulness and relaxation. Practicing mindfulness techniques and relaxation exercises can help you manage stress and reduce cortisol production, allowing your body to return to a more balanced state. Conclusion. In summary, cortisol is a key stress hormone that helps your body respond to stress by regulating metabolism, blood sugar levels, immune response, and blood pressure. While it can be beneficial in the short term, chronic high levels of cortisol due to ongoing stress can have negative effects on both physical and mental health. Understanding cortisol and its effects can help you manage stress more effectively, making this knowledge valuable for anyone studying psychology or preparing for exams like the CPC. Let's explore cognitive enhancement therapy in a simple and clear way. What is cognitive enhancement therapy? Cognitive enhancement therapy is a structured program designed to improve cognitive functioning and social skills in individuals with mental health conditions, especially those with schizophrenia or other serious mental illnesses. The primary goal of CET is to help people improve their thinking abilities, which can enhance their quality of life and social interactions. Key concepts of CET. 1. Cognitive functioning. This refers to the mental processes that enable us to think, learn, remember, and solve problems. Cognitive functioning includes skills like attention, memory, reasoning, and decision-making. 2. Social cognition. This involves understanding social cues, interpreting emotions, and effectively interacting with others. Improving social cognition is especially important for individuals with mental health issues, as it helps them navigate social situations and build relationships. 3. Structured program. CET is typically delivered in a group setting over several weeks or months. It includes various exercises and activities that focus on enhancing cognitive skills and social interactions. How CET works. 1. Assessment. The process usually begins with an assessment of the individual's cognitive abilities and social skills. This helps tailor the program to meet their specific needs. 2. Skill-building exercises. CET includes various activities designed to improve cognitive functioning. These may involve memory exercises, practicing ways to remember information, such as using mnemonic devices or visual imagery. Attention training, engaging in tasks that require sustained focus, like puzzles or attention games. Problem-solving activities, working through real-life scenarios or challenges to enhance reasoning and decision-making skills. 3. Social skills training. In addition to cognitive exercises, CET also emphasizes social skills. This can include role-playing, practicing social interactions in a safe environment to build confidence and improve communication. Understanding emotions, learning to recognize and interpret facial expressions and body language to enhance social understanding. 4. Feedback and support. Throughout the program, participants receive feedback and support from therapists and peers. This helps reinforce learning and encourages individuals to practice their skills outside of sessions. Goals of CET. 1. Enhancing cognitive abilities. The primary goal of CET is to improve cognitive functioning, allowing individuals to think more clearly, remember better, and solve problems more effectively. 2. Improving social skills. CET aims to help individuals develop better social skills, enabling them to interact more successfully with others and build meaningful relationships. 3. Increasing independence. By enhancing cognitive and social skills, CET helps individuals become more independent in their daily lives. This can lead to better job prospects and improved overall quality of life. 4. Promoting recovery. CET is part of a broader approach to mental health treatment that emphasizes recovery and rehabilitation. It equips individuals with the tools they need to manage their symptoms and lead fulfilling lives. Examples of CET in action. 1. Memory training. A participant might engage in exercises where they memorize lists of words and then practice recalling them at different intervals. This helps strengthen their memory skills. 2. Role-playing scenarios. In a group session, participants might role-play a situation where they have to ask a stranger for help. This practice can boost their confidence and improve their ability to communicate in real-life situations. 3. Problem-solving tasks. Participants may work on solving puzzles or engaging in discussions about how to handle specific challenges they face in their lives, such as managing stress or resolving conflicts. Importance of CET. Empowerment. CET empowers individuals by providing them with the skills they need to manage their symptoms and improve their quality of life. Holistic approach. CET complements traditional therapies and medications, addressing cognitive and social aspects of mental health that are often overlooked. Research support. Studies have shown that CET can lead to significant improvements in cognitive functioning and social skills, making it a valuable component of mental health treatment. Conclusion. In summary, cognitive enhancement therapy is a structured program designed to improve cognitive functioning and social skills in individuals with mental health conditions. By focusing on cognitive abilities and social interactions, CET helps empower individuals to lead more independent and fulfilling lives. Understanding CET is important for anyone studying psychology or preparing for exams like the CPC, as it highlights the importance of comprehensive approaches to mental health treatment. Let's explore the potential shift away from the DSM in a clear and straightforward way. What is the DSM? The DSM is a manual published by the American Psychiatric Association that provides standardized criteria for diagnosing mental health disorders. It is widely used by mental health professionals, including psychologists and psychiatrists, to classify and diagnose mental illnesses. The DSM includes descriptions of various disorders, symptoms, and diagnostic codes. Key concepts of the potential shift away from the DSM. 1. Criticism of the DSM. Over the years, the DSM has faced criticism for several reasons. Medical model focus. The DSM primarily follows a medical model, which focuses on diagnosing and treating mental disorders as medical conditions. This approach can sometimes overlook the social, cultural, and environmental factors that contribute to mental health. Labeling. Critics argue that labeling individuals with a specific disorder can lead to stigma and reduce the complexity of their experiences. People may feel defined by their diagnosis rather than seen as individuals with unique challenges. Lack of scientific validity. Some researchers argue that the categories in the DSM are not always based on solid scientific evidence, leading to questions about the reliability and validity of certain diagnoses. 2. Alternative approaches. As a result of these criticisms, there has been a movement toward alternative approaches to understanding and diagnosing mental health issues. These include dimensional models. Instead of categorizing mental disorders as discrete conditions, dimensional models assess mental health on a continuum. This means individuals can be rated on a scale for symptoms rather than being placed into specific diagnostic boxes. For example, instead of diagnosing someone with anxiety disorder, a dimensional approach might assess the severity of their anxiety symptoms. Cultural perspectives. Some professionals advocate for incorporating cultural factors into mental health diagnosis. This means considering how cultural background and context influence mental health and the expression of symptoms. For example, symptoms of depression might present differently in different cultures, and understanding this can lead to better treatment. 3. Focus on functioning. There's a growing emphasis on understanding mental health in terms of functioning rather than strictly adhering to diagnostic criteria. This means looking at how well individuals can perform daily activities and interact socially, rather than just identifying symptoms. 4. Holistic approaches. A shift away from the DSM may also involve integrating holistic approaches that consider biological, psychological, and social factors. This model recognizes that mental health is influenced by a combination of genetics, individual psychology, and social environment. Examples of the shift. 1. Research studies. Some research studies are exploring alternative diagnostic methods that assess mental health symptoms along a continuum rather than through categorical labels. For instance, a study might measure levels of anxiety, depression, and stress on a scale to provide a more nuanced understanding of a person's mental health. 2. Cultural competence. Mental health professionals are increasingly being trained to understand cultural differences in mental health. For example, a therapist working with a client from a different cultural background might focus on understanding the client's cultural beliefs and how they relate to their mental health rather than solely relying on DSM criteria. 3. Functional assessments. Instead of only using DSM diagnoses, some clinicians may use functional assessments to determine how a person's symptoms affect their daily life. For instance, a therapist might assess how a client's anxiety impacts their ability to work, socialize, and manage daily responsibilities, leading to a more personalized treatment plan. Importance of the potential shift. Improved understanding. Moving away from a strict reliance on the DSM may lead to a better understanding of mental health by incorporating diverse perspectives and experiences. Reduced stigma. By focusing on individual experiences rather than labels, there may be a reduction in stigma associated with mental health diagnoses. This can help people feel more comfortable seeking help. Personalized treatment. A shift towards alternative approaches can lead to more personalized treatment plans that take into account an individual's unique circumstances, cultural background, and specific challenges. Conclusion. In summary, the potential shift away from the DSM reflects ongoing discussions in the mental health field about how to better understand and diagnose mental health issues. This shift emphasizes a more holistic, flexible, and culturally sensitive approach to mental health, moving beyond rigid categories and labels. Understanding this potential shift is important for anyone studying psychology or preparing for exams like the CPC, as it highlights the evolving nature of mental health diagnosis and treatment. Identified patient. The concept of the identified patient is commonly used in psychology, counseling, and family therapy. It refers to the person within a family or group who is seen as the one with the problem, but it often highlights deeper issues affecting the entire system. Let's break this down into simpler terms. Key concepts. 1. Definition. The identified patient is the person who is singled out as having a problem. This could be a child, teenager, or adult who is exhibiting behaviors that are concerning, such as anxiety, depression, or acting out. 2. Family dynamics. In many cases, the IP is not just dealing with personal issues. Their problems often reflect or are influenced by family dynamics. The family might be struggling with communication, conflict, or other issues that contribute to the IP's behavior. 3. Symptoms versus causes. The IP's symptoms are often just the surface issues. When therapists work with the IP, they also look at the family or group environment to find the underlying causes of these symptoms. 4. Role of the therapist. Therapists often work with the IP to help them understand their feelings and behaviors. However, they also involve the family in therapy sessions to address collective issues and improve relationships. Important details. Example of an identified patient. Imagine a teenager named Alex who is acting out at school and getting into trouble. Teachers and parents may focus on Alex as the problem. However, when a therapist examines the family dynamics, they might discover that Alex's parents are having serious conflicts, which causes stress for Alex. In this case, Alex is the identified patient, but the real issues may be rooted in the family struggles. Impact on the IP. Being labeled as the IP can be challenging. The person may feel isolated or misunderstood, thinking they're the only one with problems. This label can also affect how others view them, sometimes leading to more stress or anxiety. Therapeutic approach. In therapy, the goal is not just to fix the IP, but to help the whole family or group understand and change unhealthy patterns. This might include improving communication, resolving conflicts, or changing behaviors. Summary. The identified patient is a key concept in therapy that helps us understand how individual problems can be connected to larger family or group issues. By recognizing that the IP is often a reflection of these deeper dynamics, therapists can work to help not just the IP, but the entire family or group to heal and grow. Conclusion. Understanding the identified patient concept can help you see how problems are often interconnected within a family or group. Remember that while the IP may seem like the focus of the issues, the real work often involves exploring and addressing the whole environment around them. This perspective is important for effective therapy and for supporting those who are struggling. The concepts of family system and natural social system are essential in understanding how individuals interact within their families and communities. Let's break these concepts down into simple terms. Key concepts. 1. Family system. A family system refers to the way family members interact with each other and how these interactions influence each member's behavior and emotions. It's like a web where each person is connected, and changes in one part of the system can affect the whole family. 2. Natural social system. This refers to broader social systems that include not just families, but also other groups and organizations, such as schools, communities, and cultures. These systems shape how people behave and relate to one another. 3. Interconnectedness. In both systems, every member affects and is affected by others. For example, if one family member is stressed, it can create stress for others. Similarly, if a community faces challenges, it can impact how families function within it. Important details. Roles and relationships. In a family system, each member often has specific roles that influence how they interact. These roles can change over time due to circumstances, like a parent's job loss or a child's growing independence. Understanding these roles helps in therapy and conflict resolution. Communication patterns. How family members communicate is crucial. Families with open and supportive communication usually function better than those with poor communication. For instance, a family that discusses problems openly can find solutions more easily than one that avoids talking about issues. Boundaries. Healthy families have clear boundaries. This means knowing where one person's responsibilities end and another's begin. For example, a child should not feel responsible for a parent's happiness. When boundaries are blurred, it can lead to confusion and conflict. Examples of family systems. Nuclear family. A family consisting of two parents and their children. Each member plays specific roles, like the mother who nurtures and the father who provides. Extended family. This includes relatives like grandparents and aunts, uncles living together or nearby. This system can provide additional support and resources. Influence of natural social systems. Larger social systems affect families. For example, economic conditions can impact family stability. During a recession, families may struggle financially, which can cause stress and conflict within the home. Summary. Understanding family and natural social systems helps us see how individuals operate within their families and communities. The interactions, roles, communication styles, and boundaries all shape experiences and behaviors. Recognizing these dynamics is crucial for resolving conflicts, improving relationships, and promoting mental health. Conclusion. Both the family system and natural social system highlight the importance of relationships and interactions. By understanding these systems, we can better appreciate how people influence each other and work together, whether in a family or a larger community. This knowledge is vital for anyone looking to support others, whether in counseling or everyday life. Circular reciprocal causality. Circular causality and reciprocal causality are concepts used in psychology and systems theory to explain how events or behaviors influence one another in a continuous loop. Here's a simple breakdown of these ideas. Key concepts. 1. Causality. This term refers to the relationship between cause and effect. In traditional thinking, we often see a straight line. One event causes another. For example, if it rains, the ground gets wet. 2. Circular causality. Instead of a straight line, circular causality suggests that causes and effects are interconnected in a loop. This means that one event can lead to another, which can then influence the first event again. 3. Reciprocal causality. This is similar to circular causality, but it emphasizes the mutual influence between two or more factors. It shows how two things can affect each other simultaneously. For instance, a person's behavior can influence another person's feelings, which in turn can affect the first person's behavior again. Important details. Interconnectedness. Circular and reciprocal causality highlight that in relationships or systems, everything is connected. Changes in one part can influence other parts, creating a continuous cycle. Example of circular causality. Imagine a teenager named Jamie who feels stressed about school. Jamie starts to withdraw from family activities, which makes the family feel disconnected. The family notices this change and becomes worried, which adds more pressure on Jamie. Now, Jamie feels even more stressed and withdraws further. This cycle continues, with each action influencing the next. Example of reciprocal causality. Consider a couple, Alex and Jordan. If Alex is feeling down, Jordan might try to cheer them up. However, if Alex doesn't respond positively, Jordan might start feeling discouraged themselves. Here, both Alex and Jordan influence each other's emotions and behaviors in real time. Implications in therapy. Understanding these concepts is crucial for therapists. They can help clients see how their behaviors and feelings are connected to others in their lives. By addressing these cycles, therapists can help break negative patterns and promote healthier interactions. Summary. Circular and reciprocal causality are important concepts that illustrate how behaviors and emotions are interconnected in a loop. Instead of seeing one event as the cause of another, these concepts emphasize that many factors can influence each other continuously. Understanding these relationships can help in therapy and improving communication within families and groups. Conclusion. By recognizing circular and reciprocal causality, we can better understand the dynamics in our relationships and environments. This understanding allows us to see how our actions affect others and how we can work together to create positive changes, whether in personal relationships or broader social contexts. Linear causality. Linear causality is a concept that describes a straightforward cause and effect relationship where one event directly leads to another. This idea is often used in various fields, including psychology, science, and everyday reasoning. Let's break it down into simpler terms. Key concepts. 1. Causality. At its core, causality is about understanding how one thing causes another. It answers the question, what makes something happen? 2. Linear relationship. A linear relationship means that the cause and effect can be connected in a straight line. In this model, you can easily trace the effect back to a specific cause without any loops or complex interactions. 3. One-way influence. In linear causality, the influence goes in one direction. This means that the cause happens first and then leads to the effect, but the effect does not influence the cause. Important details. Simple examples. Rain and wet ground. If it rains, the ground gets wet. Here, rain leads to the wet ground. This relationship is linear because one event clearly follows the other without any back and forth. Studying and grades. If a student studies hard for a test, they're likely to get a good grade. In this example, studying directly leads to the result of receiving a good grade. Limitations of linear causality. While linear causality is easy to understand, it doesn't always reflect real-life situations. Many events are influenced by multiple factors at once. For example, a student's grade might also depend on their attendance, participation, and the difficulty of the test, not just their studying. Use in research. In scientific research, linear causality helps researchers establish clear connections between variables. For example, if a study finds that increasing exercise leads to weight loss, it suggests a linear causal relationship. Summary. Linear causality is a straightforward way of understanding how one event leads to another in a clear, direct line. It emphasizes a one-way relationship where the cause precedes the effect. While this model is useful for many situations, it's important to remember that not all real-life interactions are so simple. Conclusion. By grasping the concept of linear causality, we can better analyze and understand cause and effect relationships in various contexts, from everyday life to scientific studies. This understanding helps us make predictions and inform decisions based on clear patterns of influence. Cybernetics. Cybernetics is a field of study that focuses on the communication and control processes in living organisms and machines. It was developed by Norbert Wiener, an American mathematician, in the 1940s. Let's break down this concept into simpler terms. Key concepts. 1. Definition of cybernetics. Cybernetics is the science of systems, control, and communication in animals and machines. It looks at how systems operate and how they can be controlled and communicated with effectively. 2. Feedback loops. One of the central ideas in cybernetics is the concept of feedback. Feedback loops are processes where the output of a system is fed back into the system as input. This helps the system adjust and improve its performance. There are two types of feedback. Positive feedback. This enhances or amplifies changes. For example, in a microphone that's too close to a speaker, the sound can keep getting louder until it becomes a screech. Negative feedback. This reduces or dampens changes, helping to maintain stability. An example is a thermostat that regulates temperature. If the temperature rises above a set point, the thermostat turns the heating off. 3. Systems thinking. Cybernetics encourages us to think about how different parts of a system work together. For instance, in an ecosystem, plants, animals, and the environment all interact to maintain balance. When one part changes, like a decrease in rainfall, it affects the whole system. 4. Application in various fields. Cybernetics is not limited to biology or engineering. It applies to many areas, including psychology, computer science, and social sciences. 4. Instance in psychology, it can help us understand how feedback from others influences behavior. Important details. Control systems. In technology, cybernetics is used to design control systems. For example, autopilot systems in airplanes use feedback from various sensors to maintain altitude and direction, adjusting automatically based on current conditions. Communication. Cybernetics also studies how information is communicated within systems. In a business, understanding how information flows between departments can improve decision-making and efficiency. Norbert Wiener's contributions. Wiener coined the term cybernetics and wrote a book called Cybernetics, or Control and Communication in the Animal and the Machine. In it, he explored how similar principles apply to both living beings and machines, emphasizing the importance of feedback and control in all systems. Examples. 1. Biological system. Consider how our body regulates blood sugar. When we eat, our blood sugar rises, and the body releases insulin to lower it back to a normal level. If our blood sugar drops too low, the body releases glucagon to raise it. 2. Robotics. In robotics, a robot might use sensors to detect its position. If it moves too far to the left, feedback from the sensors will tell it to correct its path and move back to the right. Summary. Cybernetics is the study of systems, communication, and control involving feedback loops. It emphasizes how different parts of a system interact and influence each other, whether in living organisms or machines. Understanding cybernetics helps us improve systems in various fields, from technology to psychology. Conclusion. By learning about cybernetics, we can gain insights into how systems work and how to make them more efficient and effective. This knowledge is valuable in many areas of life, including technology, biology, and social interactions, helping us understand and control the complex systems around us. Feedback loops. Feedback loops are processes in systems where the output or result of an action is fed back into the system to influence future actions. They play a crucial role in understanding how systems work, whether they are biological, mechanical, or social. Let's break it down into simpler terms. Key concepts. 1. Definition of feedback loop. A feedback loop is a cycle where the output of system returns as input, affecting how the system operates in the future. This can help stabilize the system or push it to change. 2. Types of feedback loops. Positive feedback loops. These amplify or increase the effects of a process. In a positive feedback loop, the output enhances the original action, leading to an even greater output. Negative feedback loops. These reduce or counteract changes, helping to stabilize a system. In a negative feedback loop, the output decreases the original action, bringing the system back to a desired state. Important details. Role in systems. Feedback loops are essential in many types of systems, including ecosystems, economies, and human behavior. They help maintain balance or drive change. Stability and change. Positive feedback loops can lead to rapid changes and sometimes instability, while negative feedback loops promote stability and balance. Understanding these loops allows us to predict how systems will behave over time. Examples. 1. Positive feedback loop. Population growth. If a population of rabbits increases, more rabbits can reproduce, leading to even more rabbits. This cycle continues until resources become limited, causing the population to stabilize or decline. This is an example of how positive feedback can drive rapid growth. 2. Negative feedback loop. Thermostat. A thermostat in your home works as a negative feedback loop. When the temperature rises above a set point, the thermostat turns off the heater, or air conditioner, bringing the temperature back to the desired level. If the temperature drops too low, the thermostat turns the heater back on, maintaining a stable environment. 3. Human body. Blood sugar regulation. When you eat, your blood sugar levels rise. In response, your pancreas releases insulin to lower blood sugar. If blood sugar drops too low, the pancreas releases glucagon to raise it back up. This balance helps keep your body functioning properly. Summary. Feedback loops are essential processes and systems where the output influences future actions. Positive feedback loops amplify changes, while negative feedback loops stabilize systems. Understanding feedback loops helps us grasp how various systems work, from nature to technology and even human behavior. Conclusion. By learning about feedback loops, we can better understand the dynamics of systems around us. This knowledge is useful in many fields, including biology, engineering, and social sciences, as it provides insight into how changes occur and how systems can be managed for better outcomes. Homeostasis. Homeostasis is the process by which living organisms maintain a stable internal environment despite changes in their external surroundings. It's essential for survival because it helps regulate conditions like temperature, pH, hydration, and nutrient levels. Let's break this concept down into simpler terms. Key concepts. 1. Definition of homeostasis. Homeostasis is the ability of an organism to keep its internal conditions stable. This means that even when things outside the body change, the body can adjust to keep everything balanced. 2. Importance. Maintaining homeostasis is crucial for an organism's health and functioning. If the internal environment gets too far from the ideal conditions, it can lead to illness or even death. 3. Dynamic equilibrium. Homeostasis is not about staying exactly the same all the time. It's about maintaining a dynamic equilibrium. This means that the body constantly makes small adjustments to stay within a certain range. Important details. Feedback mechanisms. Homeostasis is achieved through feedback mechanisms, primarily negative feedback loops. These loops help detect changes and trigger responses to bring conditions back to normal. Example of negative feedback. If your body temperature rises, your body responds by sweating to cool down. Conversely, if your body temperature drops, you may shiver to generate heat. Both responses help maintain a stable internal temperature. Examples of homeostasis in the body. Temperature regulation. The human body typically maintains a temperature around 98.6 degrees Fahrenheit. When it gets too hot, mechanisms like sweating and increased blood flow to the skin help cool the body down. When it's too cold, shivering and reduced blood flow to the skin help conserve heat. Blood sugar levels. Homeostasis also involves regulating blood sugar levels. After eating, blood sugar rises, prompting the pancreas to release insulin, which helps cells absorb sugar and lowers blood sugar levels. When blood sugar drops too low, the pancreas releases glucagon to raise it back up. Disruptions to homeostasis. Factors like illness, extreme temperatures, or stress can disrupt homeostasis. For example, if you get dehydrated, your body will signal thirst to encourage you to drink water and restore balance. Summary. Homeostasis is the process that helps living organisms maintain a stable internal environment despite changes in their external surroundings. It relies on feedback mechanisms, primarily negative feedback loops, to adjust and correct any imbalances. Understanding homeostasis is essential for recognizing how the body works to keep itself healthy. Conclusion. By understanding homeostasis, we can appreciate how our bodies manage to stay balanced and healthy in various conditions. This knowledge is important not just in biology, but also in medicine and health, as it helps us recognize what happens when the body's internal environment is disrupted. Adaptability. Adaptability refers to the ability of an organism or system to adjust to changes in its environment. This concept is crucial for survival, as it allows living beings to cope with different conditions and challenges. Two important terms related to adaptability are morphostasis and morphogenesis. Let's break down these concepts in simple terms. Key concepts. 1. Adaptability. This is the general ability of an organism to change and respond to its environment. It can involve physical changes, behavioral adjustments, or physiological adaptations that help an organism survive and thrive. 2. Morphostasis. This term refers to the processes that maintain stability and balance within an organism despite external changes. Morphostasis focuses on preserving the existing structure and function of an organism, ensuring it remains stable over time. 3. Morphogenesis. In contrast, morphogenesis is the process through which an organism develops and changes in response to its environment. It involves alterations in form and structure, allowing the organism to adapt to new conditions or challenges. Important details. Importance of morphostasis. Morphostasis helps organisms maintain homeostasis, ensuring that their internal environment remains stable. For example, when the temperature outside changes, morphostatic processes help regulate internal body temperature to keep it within a healthy range. Examples of morphostasis. A human body sweating to cool down when it's hot is an example of morphostasis. The body works to preserve its normal temperature despite external heat. A plant may close its stomata during hot, dry weather to prevent water loss, maintaining its internal water balance. Importance of morphogenesis. Morphogenesis allows organisms to grow and adapt to changing environments. This can involve physical changes in shape or function that enhance survival and reproduction.